Hello, and welcome to Voices in Local Government, an ICMA podcast. My name is Emily Sparks. I am a program director in ICMA's Innovation and Research team, and I'm joined by Ben Spoer from the NYU Grossman School of Medicine. Ben is an epidemiologist and data scientist focused on improving health outcomes through data-driven decision-making, and he serves as the program director of the City Health Dashboard. Welcome to the podcast, Ben.
Thanks so much, Emily. It's great to be here. Thanks for inviting me to your kazoo review podcast and other obnoxious noise-making devices.
That is the new official name. I've been really looking forward to the conversation that we'll have today. I think in particular, it's a good time to have it. And, our members, ICMA's members and other local leaders are under a lot of pressure right now. I mean, I'm sure you see it in the news, we see it everywhere, but the pressure really to improve health outcomes in their communities. They're being asked to make decisions that are grounded in data, right? But access to reliable neighborhood level data is not always that easy to come by. We at ICMA have had the pleasure of working with you all on the City Health Dashboard for a while, and this is one of the gaps the City Health Dashboard is here to fill, right? A free online tool that is providing that data for communities across the country. We've been proud to be a bridging partner with you all on this work since 2017, so that was even before your official launch. And so we've seen really firsthand how powerful having that local data can be in shaping decision making. And that's what I'm hoping we can talk about today. But first, we're gonna, we'll put our kazoos aside and take a time machine back if we can. And if you can take us back a little bit and tell us about the development of the dashboard, in particular, what your team saw as the way that communities were accessing or really struggling to access local health data.
Absolutely. It's been great to work with ICMA since before the websites even came out. As you point out, we've really benefited tremendously from our partnership. The origin story for the City Health Dashboard is probably similar to the origin story for a lot of important tools that we now rely on in municipal government, which is that some members of our leadership, I wasn't yet part of the project yet, we're out in the world talking to mayors and city council members and others, and they were telling us that they really felt responsible for the health of the people that live in the cities that they support, right? It's like the EMS produces data, the sanitation department produces data, to a greater or lesser extent, public health departments produce data, and those data are useful, they're integral, and they don't give the entire picture for a given city. And so there was this real gap between what mayors and other leaders had available to them and what they felt responsible for. So in 2017, the City Health Dashboard team started talking to a number of cities, to 4 different cities. It was Flint, Michigan, Waco, Texas, Providence, Rhode Island, Grand Rapids, Michigan. And the conversation with these cities was like, what do you need, right? What information would help you fulfill this responsibility that you feel pulled by strongly, but don't have the information you need to fulfill? And so the dashboard was then released in 2018. And we started out with about 500 cities, all with population 50,000 or above. We've since expanded to over 1,200 cities. Now it's 1,225 as of this recording. There'll be more soon. And the metrics change frequently. We, for instance, during the pandemic, had a COVID local risk index metric, which we then retired. We've added metrics related to credit insecurity, broadband connection. Perhaps most exciting is we just released life expectancy estimates for most of the cities on the City Health Dashboard going back over a decade. So one can track how life expectancy changed through big changes in public health over the years. And we're always adding new features, some of which we'll talk about in a minute.
Yeah, absolutely. And you kind of talk about a lot of things. And when we are out in the world talking to people about the dashboard, they kind of frame it around healthcare, right? They think we're talking about city health and healthcare and healthcare infrastructure. But one thing that working with you all over the years has reinforced for me is that community health is shaped by much more than healthcare in particular. And so you gave us a preview to some of the measures, and I think we can use our imagination to think about how that connects to local government. But if you could, what are some of the everyday local government decisions that impact community health outcomes?
Yeah, it's like, how do I count the ways, right?
Right?
Local governments do a lot that shape health. And, there's been over the past 30 years or so, the growing recognition of this group of factors that drive health called the social determinants of health or social drivers of health. And these determinants or drivers of health don't really happen in any given person's body. They affect health strongly, and they happen through policy decisions or the built environment or access to healthcare. And city governments can affect a lot of these drivers of health. Just a few examples include how well lit is the park, right? If the lamps in the park burn out, people are going to feel less safe exercising, especially when it's dark out. Smoking policies, right? Where is it allowable to smoke in a given city really affects how easy it is for people to smoke in a city. Another example that I've been hearing people talk about a lot is code enforcement, right? All of these really important and often effective policies kind of lose their teeth if they're not enforced. A lot of these examples also come through the public health department, like public health education campaigns, right? Anti-smoking or pro-vaccination or medication access. Some of them come through different departments. Zoning is a great example. Zoning can affect how easy or difficult it is to walk around in a city, known as walkability, which is directly related to how much people exercise. Also, where are their businesses, right? And where are their businesses often affect, am I going to walk to the corner to get the thing I need from the store, or am I going to get in the car? So there are certainly examples of metrics on the City Health Dashboard that cities are less involved in, but it's hard to think of one that a city could not affect at all.
Absolutely, and I'm sure that as we talk, and you mention more of these examples, it'll connect with members and any listeners of what those might be. But our listeners do love to hear specific examples. So I was hoping maybe we could turn to if there are any particular communities or projects or anything that you have your impact stories that illustrate what becomes possible, big or small, with access to this type of data.
You used the right buzzword there. We have a section on our website called Impact Stories. On the Impact Stories section of the website, you can see like a dozen of these, but just to highlight three of them that come to mind. Chattahoochee Hills in Fulton County, Georgia. It's like 3,500, 600 people. It's a small city. They wanted to do two things. They wanted to strengthen their local food environment, and they wanted to build a walking trail for folks in the city to have access to a physical activity resource. And so they used the City Health Dashboard's data to accomplish this in two ways. Chattahoochee Hills applied for a grant from the Food Well Alliance, and they used City Health Dashboard data in their grant application, including, for instance, food insecurity, walkability, other important metrics that relate to the food environment, and like how do people get to the food if the food is there, right? Is the environment walkable enough for people to get to the grocery store? And they were successful in their grant application. So now they have more resources to work on improving the food environment in Chattahoochee Hills. They also used our data to bring people together to have conversations about the walking trail they wanted to make, right? So again, walkability, physical activity is another metric they used. And it set the scene, set the stage, I guess, for conversations around this walking trail. Another example is from Decatur, Georgia. We received an application to our Put Us on the Map challenge from the Decatur Emergency Rescue Service, which we don't always get applications from like fire, police, emergency services. They had this really insightful question in that they had created their own heat maps of where they go out on calls, right? And so they knew where the hot spots for their calls were, but they wanted to understand the deeper context around those calls. So they used a lot of our metrics once we were able to provide them after the team successfully applied to our Put Us on the Map challenge. And through metrics like frequent physical distress, frequent mental distress, physical inactivity, and others, they were able to better understand and allocate their resources. And so we've reached out to them to find out, did it increase efficiency, which is like the question people always want the answer to. But they also told us that having a better understanding of what's going on in the city helped them provide services better. And then the third is Maplewood, New Jersey. They use dashboard data to think through health disparities in Maplewood. And we have a lot of data that are related to health disparities. We have a lot of data that provide race and ethnic group demographic breakdowns. We also, because there are maps of a lot of our metrics at the neighborhood level, you can see spatial disparities, like is blood pressure really high over here and lower over here? Same thing with diabetes and other metrics. So what they did is they used our metrics to successfully apply for a grant from the New Jersey State Department of Health to focus on these health disparities. What they also discovered is they were running this health fair, and the folks that showed up at the health fair were not necessarily the folks they most urgently wanted to reach, right? They were tending to reach folks who already were accessing healthcare effectively, so they knew their blood pressure, for example. What they did was they moved the healthcare from one side of the park to the other, and they ended up finding everybody they wanted to reach on the other side of the park. It's like they moved it a block using local data, and were better able to reach the populations they wanted to reach. And so this was like a huge victory for us, because we often tell folks that having hyper-local data are going to help you to better guide your resources. And then somebody did it, and they proved us right, and we loved it when they proved us right. Like, it was a great moment.
We do love that. We love when we say, hey, use this data in your grant applications and it's successful. And, use it this way. I'd love to put us on the map challenge, getting a shout out here. And those are really, really good examples. And so for any listener that is hearing that and thinking, oh, okay, so how do we get into that? But maybe they're overwhelmed. Or where do we start? A challenge that we do here is that having access to the data is just part of our equation, right? It's also the capacity, the confidence to kind of interpret it, know what to do with it, apply it. Personally, I know from working with you all that you put a lot of thought into that, and into trying to build the website in a way that helps with the accessibility and the understanding and the data literacy when you were designing it. And if you could talk a little bit more to that, so it maybe dispels any, for those of us that aren't data wonks, make us feel a little comfortable going into that space.
Yeah, it's so right. I kind of feel like this whole data revolution can feel a little bit like the creation of the internet or the release of the smartphone for folks. It's like, hey, there's a new technology you have to learn. We're just going to assume everybody knows how to use it, right? And if you don't, you can't talk about it because we'll make fun of you. That's not what we're doing at the CL Dashboard. There's two ways in which we really approach data literacy. One is we're trying to make a website that is self-evident, that is easy to use. So there's a number of ways in which we do that. We sort of on an ongoing basis are recruiting folks to participate in what's called usability testing, where we ask them to use the website and tell us, was it easy to use? Did you understand it? And were you confident in how you used it? And so we've made a number of changes to the website in response to those tests, those usability tests. The user interface is designed to be pretty intuitive to understand. So anytime you get to a metric page on the City Health Dashboard, you get the scale bar along the top. It has a number of features. Yeah,
and the colors. Love
right,
the colors.
The colors. It's interesting. An interesting factoid about the colors is we wanted to make them like self-evidently different from one another, right? So you could tell the difference between the different categories. But also we audited them for ease of use for people who are colorblind. Right. So a lot of the color spectrums that you see on websites in a previous version of like data literacy world went red to green. And if you're red to green colorblind, you kind of are looking at it's like indecipherable. So that's why we chose, part of the reason we chose the colors we did. It also has a little caret that tells you the City Health Dashboard city average. It gives you a big old bold line for what the metric estimate for the city you're looking at is. We tried to make it really easy to use, and doing so requires understanding what people think it means when they see a little carrot or a big old band and that sort of thing. We also are very transparent in our data documentation. So we have a data dictionary, we have a technical document, we have a sort of medium dive metric background one pagers. So if you click on a metric, it'll tell you why we thought it was important to measure it, give you some citations, give you a lot of times the formula we use for estimating that metric, the data source, so that if you look at something, you're like, I want to know more, or I don't feel like I understand it, we can provide all the information right there. So that's a lot of the stuff that we do for website usability. I also have been telling folks, especially starting earlier this year, that bridging the gap from data to action, the missing piece is no longer access to data. There are a lot of great tools out there to give people access to data. The other half of the bridging that gap is data literacy, is giving people the knowledge and confidence they need. And I think it's really great that you said confidence. The confidence they need to use data. And so we've started doing a lot more data literacy work. We're putting out like videos and blogs on how to understand basic statistical concepts. We also do one-on-one consultations with cities. So if you are listening to this and you are in that boat that Emily just described, where it's like, I really want to use data, but God, these people are using indecipherable language. What are all these numbers? You can reach out to us and we'll sit down with you and answer your questions and really give you the sort of the crash course on using data.
Then that was a perfect example of how you all at the dashboard have thoughtfully evolved over the years and kind of turning the data into action. You'd had a feature that you added some time ago where you could compare communities. You're always adding new things, and a new feature that I'm particularly excited about, because I know that when we would go places, people would say, "Oh, but I really need this specific area. I really need that specific area." And my understanding is that we can now drill down to a more specific area. And I was hoping you could describe, how that feature works, why you added it.
Totally great question. The feature you're talking about, we call it customize an area. And the user interface portion of it is pretty simple. You go to the city you care about, and it allows you to click on a group of census tracts. And as you do, the website will recalculate the metric estimate, whatever metric you're looking at, for that group of census tracts. So here's a hypothetical example, right? Let's say that you are in a mayor's office, and you know that there are a lot of folks who don't have access to the internet, to a high-speed internet connection in the north part of your city, right? You know this, and nobody's going to believe you until you put a number behind it, right? And that's the position a lot of folks are in, is they know the problems going on in their city, they know the challenges, and they have to be able to put a number behind it in order to secure a grant or to rally stakeholders, rally partners around that issue. So you go to the City Health dashboard and you take a look at the group of census tracts and you just click on them. And you'll get a recalculated estimate of broadband connection for that part of town. And what you might find is that in your city, the broadband connection rate is like in the 70s or 80s, 70 or 80% of people have high-speed internet connection. And in this part of town, it's 60%. So you get the number and you get the comparator to the rest of the city. We're excited about this for a number of reasons, right? First is that it makes the website geography agnostic in a way that it has never been. And that's important because we know that the geographies, the places that people care about, don't always fit into the boundaries provided by the US Census or the City Health dashboard, which uses US Census geographies, right? The world is more complex than can be measured by the maps that were provided. Second, it unlocks a whole big different group of users, which is community-based organizations, right? There are plenty of community-based organizations that care about a whole city. There are also plenty that care about a specific neighborhood or part of a city. If you are willing to spend the time clicking on the different census tracts, you can create estimates for lots of different geographies: wards, council districts, school districts, hospital catchment areas. There's really a substantially increased potential to provide the data people need using this feature.
It absolutely was. And I know that back in my time in local government, some years ago, it's a tool I would have really loved to have dug in, when we were focused on specific communities or specific needs and we knew where they were to be able to have a tool like this to tap into. But I do want to, kind of even simplifying that question and thought of a community that might, still be a little bit reluctant or overwhelmed, where would be the very first place you would suggest that they start?
Yeah, it's a great question. Um, we recently put together a resource we call the Playbook, which is meant for cities who are starting to do important things with data. And it's a brief introduction to the world of municipal health data through the City Health Dashboard. But at the back, it's got a number of worksheets, which really are pretty simple to fill out. And it asks the people filling it out to think through some basic questions. What do I want to do with these data? Where have I looked for these data? What questions should I ask about these data? And so it's a great place to start for people because it does two things. It conquers that like being overwhelmed by the first step issue, right? Like I have that problem with putting away the laundry. It's like, why do I own so much clothing? Why am I so poor at impulse control, right? It's a little bit of a different example, but that first step can really overwhelm folks and slow them down. And the worksheets conquer that because it's just have to just fill out a line, right? By the time you've filled out a bunch of those worksheets, you have a really clear use case. And that helps you talk to folks who may have more data training or knowledge about certain data sets and say, here's exactly what I need. And it gives you a little bit better understanding of the data in general. We also encourage folks to reach out to us. You can email us at info@cityhealthdashboard.com. And we talk to folks about data every day of the week. Not so often on the weekends, though it does happen. If we could do so on the weekends, we would, right? It's like we talk about using data to guide action as much as we can. And sometimes folks, feel like they don't know enough or they're not ready. That's not the business we're in. We're in the business of support and empowerment. So email us, reach out, and one of our team, or probably two, because we want someone from the data team and someone from the dissemination promotion team, might even be me, is going to get on a call with you and talk you through the data. So don't hesitate to reach out.
Fantastic. Well, Ben, thank you. We will make sure that we link that playbook in the notes for today, as well as the, make sure I get it right, info@cityhealthdashboard.com email address. Ben, really thank you so much for taking the time to talk with me today about this work. Again, I'm going to repeat it. If our listeners are interested in learning more about the City Health Dashboard, you can visit cityhealthdashboard.com. We don't have time today, but there also is a sister site called the Congressional District Health Dashboard that I encourage you to check out. That is the congressionaldistricthealthdashboard.com. I would also encourage all of you, personally, I would encourage you to connect with Ben on LinkedIn, where he's always sharing insights about data, public health, built environment, covering topics like the connection between walkability and public health, like he got into a little earlier today. But one more chance, Ben, before we wrap up, any other resources that you want to encourage our listeners to explore?
There are a lot of great public health and health data websites out there. County Health Rankings and Roadmaps is a great one. SDOH in Place Network is a great one. Data Diversity Kids, all providing different things. We often get questions from cities that are not on the dashboard. I'm not on the dashboard. You made all these promises. What should I do? And the answer is we have an initiative called the Put Us on the Map Challenge, in which your city can apply to be put on the dashboard. It's a pretty lightweight application. We're not trying to put anyone through any hoops here. Really, the point here is that when we produce data representing smaller groups of people, there's more folks need to know about the data to use them responsibly, and we want to be able to talk to someone about it and explain the data and its strengths and limitations. Applications open in June, right? So it's like right now as of this recording. And you can also reach out to us if you have any questions about it. But we are very excited to put more cities on the dashboard. I think through the Put Us on the Map challenge, we've put about 185 cities on the website since its inception. And we have built relationships that we cherish and love with these cities. So if you want to be on the website and you're not, now's the right time to apply to be added.
That's right. Okay, so once again, the website for the program is cityhealthdashboard.com. The website and the resources we've discussed today will be linked wherever you are listening. And that's all. So thank you, Ben, and thank you everyone for listening.